I'm Dr. Amy Brenner, and I perform several different types of cosmetic GYN surgeries. And today I wanted to tell you the difference between some of those. In order to do that, I'm actually going to bring out the first textbook I ever had in my medical career, Netter Anatomy, that I used when I was taking gross anatomy as a first year medical student, and just go over some of the anatomy of the female vulva. So the female vulva is actually all of this, what we see on the outside. And so if you zoom in here a little bit, the first structure I wanted to mention is actually the labia minora, which is this tissue right here, or actually the inner lips. And so if a woman chooses to have a labia minoroplasty, this excess tissue can be excised or actually almost completely removed. So removing that is called a labia minoroplasty. About 90% of the time when women are choosing to have a labia minoroplasty, I actually also recommend a clitoral hood reduction along with that. So I wanted to go over some of the anatomy as it relates to a clitoral hood reduction. This little nubbin right here is actually called the clitoris. Now in women, we just see a small portion of the clitoris visible because the clitoris actually dives down deeper behind it and then curves around like this. The tissue surrounding the clitoris or covering the clitoris is actually called the clitoral hood. So the procedure called a clitoral hood reduction is just excising some of the tissue that covers the clitoris. It almost looks like a hood of your coat, hence the name clitoral hood. So that procedure is called a clitoral hood reduction. Another procedure that's commonly done is actually called a labia majoroplasty. And these are the labia majora, or the outer bigger lips. As women age, this tissue can become lax. And so women may elect to have this procedure to actually cause a tightening or more smooth look to the labia majora. This anatomic area is actually called the perineum, and it's the space between the opening of the vagina and the anus. So this tissue can also become lax, have excess tissue. Sometimes the labia gather or convalesce in here, and that needs to be excised. So a perineoplasty excises all of this tissue right here. I will also perform a perineoplasty if someone has what's called a gaping vagina, or actually even this picture kind of has the appearance of a gaping vagina, where the back wall of the vagina is actually seen just in this position. So in that case, a perineoplasty, this excess skin is removed, and the first couple centimeters of the vagina are actually tightened up to close the appearance of the vagina. Another procedure is called a vaginoplasty. And so a vaginoplasty is a procedure where I actually go all the way to the full length of the vagina and dissect down and open up and find where those muscles are and tighten those muscles and then remove the excess skin. So a vaginoplasty is a procedure that's performed to actually tighten the vaginal canal. Some physicians may be calling a vaginoplasty when they're actually only doing a perineoplasty. So in my practice, when I do a vaginoplasty, I'm actually doing full length of the vagina versus a perineoplasty is either just removing this excess skin or just tightening up the first couple centimeters of the vagina. And lastly, another procedure that we do here at Amy Brenner, MD and Associates, is removal of anal skin tags. And what that is there's just excess skin around the anus that some women may choose to have that excised. And so that is performed in that area. Certainly the only way to tell what somebody is desiring or what somebody may want is to have an individual consultation, and I'd be happy to review this anatomy with you in person.